Thank you very much. Thank you very much for that. So I'm Dr. Jennifer Jenga, and the CEO of Canada Homecare Group. Ours is a mobile clinic that provides non-urgent care to people across Alberta of all ages. And part of that care involves administering the COVID vaccines, Pfizer and Moderna, as they are here in our province. And so happy to start the conversation. And so I'm going to share my screen. And for today, what I'm going to do is to recap what we have gone over the past two sessions. And I will talk less this time. So I'd like to get a conversation going in the community because this is our final series. So we'll go through some of the things we talked about earlier on, and maybe some updates in terms of statistics and some changes that are coming up in the province, and maybe even globally. It's also good to have that picture that although we're here in Alberta, it's good for us to know what's happening in other parts of the world. So I'm going to share my screen. Can you see my screen? It should be.
Yeah.
Okay. Okay, so like I said, Canada Homecare Group, we have doctors and nurses. One of our nurses, Bibi, might be joining us later, and others are out doing some vaccines and other primary care stuff. So we're going to recap, like I said, where we started, what COVID-19 is. We all kind of remember. But I will start with statistics. I love statistics. So just looking at the figures, those are the figures globally, and those are that was yesterday's figures. Unfortunately, we've had a lot of this COVID going on across the world, and we've unfortunately lost over 4 million people. However, we're trying to fight this disease by vaccinating as many people as possible. So globally, we've vaccinated over 4 billion people. So we're doing well. In Canada, this is again yesterday's statistics. We had 331 cases. To add to yesterday, we have had unfortunately over 1 million cases. They still are 25,000 cases, active cases. The total resolved 1 million, and as of yesterday we had 6 deaths. And the total death for us as part of that global statistic, we've lost over 26,000 people. So in Alberta, we've had so many cases confirmed, 9,666. There were 1,112 cases yesterday, on the 25th, and it's been a while. The news, they were saying that we haven't had so many cases, at least over 1,000 in over months, the past couple of months. So I think our numbers are really going up. And I guess one would kind of expect that because we've been up and about. It's summertime, people have been going out and mixing and mingling. So we're bound to have cases increase. I think this is no surprise. Unfortunately, we've had people in hospital, 308 of those, and 64 in ICU. And this is a breakdown in the province where these cases are. So right now, unfortunately, Edmonton is leading, followed by Calgary, then the North Zone, South Zone, Central Zone. There are cases as they are. I think we've also tried to vaccinate as many people as possible. So over 5.5 million people, the total doses have been administered. The eligible population, we've had 77.6% have had their at least one dose fully vaccinated. They were almost at the 70% chance. So as people were vaccinating, we're trying so hard to get people to get their second dose. Especially now children are going back to school. We want to make sure as many of them who are eligible are getting vaccinated. So just a brief, very, very brief recap. We all know that COVID-19 is a respiratory disease. It was discovered in 2019. It spreads from person to person through respiratory droplets. When someone coughs or sneezes or talks, it comes, from someone touches the next person or an object that has had the virus on it, and then you touch your mouth, your nose, ears without washing, without hand washing. You can have mild disease, moderate or severe disease, and people who are above the age of 65 or those with pre-existing conditions are more at risk. You may have symptoms that last for about 14 days after you've been exposed to COVID-19. So they don't come up right away, they take quite a while. And then we know the symptoms, the coughing, the terrible breathing, you may feel feverish, have some muscle aches, body aches, this loss of smell or taste. A lot of people reported, I lost my taste. People feeling well, some abdominal symptoms there, especially children, they tend to have these abdominal symptoms and sometimes skin changes or rashes. So the virus tends to last for a long time. When people are infected with the virus, they seem to be contagious in the first week, and then symptoms show up later. It can show up later. So unfortunately, it takes a while for symptoms to show up, and the virus lingers in the body for a while. Some studies have said for about 40 days, close to 40 days, you may still have that virus. You may still be shedding that virus in the body. Prevention, we've heard of the words quarantine, isolation over the past month or months or year, where people, quarantine is if you've been in close contact with someone who's had COVID, you kind of you sort of have to stay away from other people. You're advised to get tested, and then isolation, separate people, those who have been affected. So in their home, we say, you've been infected by COVID, is to have your own space, your own utensils, use your own bathroom. So quarantine, isolation are sort of terminologies we're now used to, unfortunately. So prevention, simple things, washing of hands. We're all taught as young children to wash our hands. This is a time when it's really, really important. If you can't get soap and water, use the sanitizers, avoid close contact with people outside your home, maintain that at least 6 feet from others. Wearing a mask in public if you don't feel well, cover your nose, when you're coughing, you're sneezing. Disinfect surfaces that you use, sinks, toilets, keyboards. And if you have symptoms, please stay away from other people. So those symptoms of fever, coughing, you're not breathing, shortness of breath, sore throat, get a COVID test. And then if things are going really bad, call 911. So we started hearing about this variants of concern. So why are they of concern? There was the original virus which came from Wuhan, China, but then with time, the virus mutated and gave us these variants. So the reason why they're of concern, because they are easily transmitted and they create severe disease where people are either hospitalized in ICU or unfortunately lose their lives. And then they are not as responsive to the vaccination or to the treatment that's around currently. What are these variants of concern? We still have the Alpha, which came from the UK in September 2020. The Beta one came from South Africa in May 2020. The Gamma from Brazil and the Delta from India in October 2020. So I'll talk about the Delta variant. That's the one that's really causing havoc in most parts of the world. Here in North America, we know the States is really struggling. It's highly more contagious, nearly twice as contagious as previous variants, and it causes severe disease, especially in people who are not vaccinated. And I think the other thing to remember is that if you're fully vaccinated, you may catch it, you may spread it, but you don't get as sick, and you are infectious for a shorter period of time. So this is our variant that we're really concerned about globally. So there's a lot of numbers here, but I think what we want to look at is just if we look on the left-hand side, the very extreme left of that column variant grouping, we see our variants we've just talked about. It is 1, 2, 3, 4, just look at that for now. And if you follow that through over the months, we've had an increase in variants. We're now up to 98.9%. There's been some sort of ups and downs, but we're at 98%, 98.9%. And the variant that we really worry about is that Delta variant. That's the one that's being found now. It's more predominant, is the Delta variant. So vaccines, why vaccinate? So it's a critical prevention measure to help end the pandemic. That's what we're looking at, vaccination. We've had diseases like polio in the past, and we know that vaccines did a great job to eradicate polio in most places. There may be some outbreak, but in most cases we managed to eradicate polio because people got vaccinated. So what vaccines are we talking about this time? We have the 4 categories of vaccines: whole virus, protein subunit, viral vector, nucleic acid, the mRNA. We had started with the AstraZeneca and Johnson & Johnson, but here in Alberta, we're looking at Moderna and the Pfizer. So that's what we'll talk about. And in Alberta, people age 12 and above are eligible to get the Pfizer or Moderna. Okay. Just one more thing, we can mix and match them now. So if you had Pfizer first, you can get Moderna on the other way around. Mrna viruses, we know how they work. They trigger protein in our bodies. This protein then, once triggered our body, that makes antibodies. These are the antibodies that we need to fight the virus. So you have your memory cells, their memory, so we'll call them memory cells. When they see the virus coming into the body, they know they're going to attack. So antibodies are now produced. They will attack COVID when COVID comes around. So that's how mRNA works. And those are the ingredients. Of key here is that we don't have live COVID. I think that's the thing, because people were asking, these vaccines, do they contain the COVID virus? No, they don't. You can see the ingredients there. There is no COVID listed, because we ask that a lot when we go out. Does this vaccine contain COVID? And the answer is no. You need 2 doses. We're told 21 days, in states will be 21 days. Here we're saying 4 weeks later. AHS usually sends a message and say you're now eligible to have your second vaccine. And like you said, you can mix and match them. If you had the Pfizer before, you can have Moderna or the other way around. I've heard a lot from people saying, oh, well, if you mix them, you get very unwell. There is that talk. Others say no. I was surprised last week we got a lady who said I actually want to mix them because you don't get very sick. So again, the information is very contradicting. I'd never heard about that one before. So she asked for Moderna, her first one. So second was going to be a Pfizer. So that's what she heard from her friends. So we know the viral vector vaccines, they use a harmless virus such as adenovirus that causes the common cold. And when that one enters in the body, again, an immune response is created so that you have antibodies again to fight COVID. But won't worry about AstraZeneca and Johnson & Johnson because we're not giving those ones here in Alberta. And again, even with them, we don't have COVID because we've been asked this question, is there COVID contained in the vaccine? No, there is no COVID here. So what are the side effects? This is what put people off. Just today alone, we had someone calling in, they're due for the second COVID vaccine. They said, no, I won't have my second because my wife got her first one and she was in bed for 4 days. So I will never get a second COVID vaccine. That's it for me. And then he said, until the scientists get it right. So he kind of passed the stage where I was trying to talk to him about side effects. He says, no, they want to make us sick. This conspiracy theory came up again. So he wasn't interested. So he said, I had the first one, I'll just go with that. So what are those COVID vaccine side effects we hear about? Again, redness, warmth, swelling. You may get a little bit of that where the needle goes into the skin. That is normal if you're having any kind of vaccine. You get those kind of local symptoms. You may feel tired or unwell. A lot of people talk about being tired. A few have talked about headaches, fever and chills, body aches. That's also very common. You kind of feel like you've had flu. You're having a bad flu. Some may develop a cough. The last time we said side effects, unfortunately, are very hard to just brush off because people come from places where they've suffered things like malaria. Malaria gives you almost these exact symptoms, and it's a very unpleasant thing. So when you tell someone, oh, these are the side effects you may get, they're like, no, 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 I don't want to get sick. I'd rather stay away from the vaccine, right? Unfortunately, something enters your body. It's your body building that immunity. You may get these side effects. It doesn't mean that you're getting sick. Doesn't mean that you have COVID. It means your body is mainly it's just creating that response. But these side effects have been a put off for some people. We've had people who said no to the first one, and those who've had the first one said no to the second one because of the side effects they've heard their family members or friends have received or have had. So unfortunately, when you get COVID-19, we talked about this, it also creates kind of similar things there, chest pain, tiredness, or fatigue. People will get COVID, they end up with these symptoms we talked about briefly, but I'll just skip that slide because I want to talk about the myths as well. I want us to have some time to talk at the end. What are some of the myths we went through last time? People said, oh no, I'm not going to vaccinate my children because, you know, for instance, MMR causes autism. No, it does not. It's been proven, studies have shown that it doesn't. You may be, your child may be diagnosed with autism around the time they received MMR, but the two are not associated. You know, some people say, you know, natural prevention is better. We've had people talk about ginger and lemon and honey. You know, I take that all the time. I'm very healthy. Those things are good. Yes, continue taking them. They're good for immunity, but they're not enough to prevent COVID-19. We've had other myths we discussed last time. It affects fertility. We have a lot of people concerned, especially the ones we've got from people from Africa, who are very concerned that they won't be able to have children. And so we've had to show them, you know, data coming from the researchers and scientists showing that there's no connection with fertility. It does not affect your fertility, but we want some over, some not. They're convinced. COVID-19 vaccine will turn you into a zombie. Haven't seen anyone turn into a zombie yet. So who knows, maybe they're yet to see one. It has terrible side effects. Yes, it does for some people, right? But if you compare having COVID and then having COVID-19 vaccine, you've got to weigh the pros and cons, you know. This is short-lived, but, you know, the COVID can be terrible, especially it may have some long-lasting effects. It is not just another flu. This is a very deadly disease. We've talked about that. No, it cannot be cured by vitamins and minerals. Those things boost your immunity. So you are strong enough to fight off infections, right? But they're not enough to prevent COVID-19. There was this one about a link between 5G mobile networks and the spread of COVID-19. That one came about as well. And hopefully people don't believe that anymore. There's a one about COVID-19 vaccines make our bodies magnetic due to microchips that are part of the vaccine. Very, very, very clever way of thinking, but no, the vaccine just has those ingredients we talked about. There are no microchips in the vaccine. And then there's the religious component, the mark of the beast that has been talked about by some Christians who believe that the Antichrist is testing people and people have been asked to put a mark on their bodies. Again, if you looked at the ingredients, there's nothing like that in there. So those are some of the myths, and we can talk about some more. If people have heard some more interesting ones over the time, I would love to hear what else people are saying out there. So just globally, you know, we unfortunately, like I said, it's good to also just keep in touch with what's happening over the, you know, across the world. And we know that the WHO, the Director General, really is a bit disappointed that some poor countries haven't received even their first doses. Last time we said the percentage of people who received the COVID vaccines in poor countries was 1.1%. They continue to get some, against the donations from first world countries, but we know that not everybody has received their first. And therefore, we'll talk about the booster shot and kind of the feel of people around that, because WHO thinks, again, that there's a lot of unfairness there. Why would people get their third shot if people haven't even received their first one? So we're now going to talk about the booster shot. Should we have that? Should we not? So some countries have gone ahead and they've planned for this booster program, because I think last time we were talking about the third shot. Are we going to have a booster shot? Are we not? The UK, for instance, wants to start in September. And they have a criteria there who will get their COVID booster shot. They're looking at people with weak immune systems, people over 70, adults who are extremely vulnerable, people living in care homes, and their frontline workers. They believe that after some time, your immunity does wear out, and therefore getting a booster shot just increases your immunity. The US is also thinking to begin in the fall, and it's looking at people who are eligible starting 8 months after they receive their second dose of Pfizer or Moderna, but they're waiting for approval again from the FDA. So, yeah, here in Canada, in Ottawa, a third dose of the COVID-19 vaccine is now available to residents. Again, Ottawa is looking at people who are severely compromised, right? Transplant recipients, patients with some cancers, hematological cancers, recipients of an anti-CD20 agent, and again, people in the long-term facilities and retirement homes. We know that the people in the long-term care homes got their vaccines as early as January. So I guess the fear is that by now, their antibodies are sort of have decreased. They're already old, they're seniors, so they've got low immunity. So they see the need to boost their immunity by giving them a third vaccine. So in Alberta, where are we at? I think they're waiting. Alberta's waiting, from what I understand, and just listening to the news for what's coming out of the US. I think we tend to follow what the US is doing. Unfortunately, we're in our fourth wave. That's unfortunate that hospital numbers, as we know, are going up. So, you know, we've had people saying, okay, well, we're going to get the flu vaccine. Can we get the third shot before? Makes a lot of sense. You know, should we get a COVID vaccine now? Because we have to wait for 4 weeks before you get another shot, you know, of your body to recover, then get the flu vaccine. Do we do that? Or what do we do? We'll just wait for the US. Because the last time we talked, we know that Israel's already started with their program. They're giving 60 plus. The UK is going to give 70 plus. Right? I think the US is going to make it available for all age groups, those who are eligible, basically. So where we at in Alberta, I think is just a waiting game. So far, we haven't been told, as vaccinators, we have not been told anything about the booster shot, so we don't talk about it. Families ask us when we go in, but we don't say, we say, well, we're just waiting to hear back. So I think discussions are being held, and so we'll hear back hopefully soon. It'll be very interesting to note, you know, what's going to go first, a booster shot or the influenza or the other around. We don't really know at this stage. And then the last thing I wanted to talk about was the passport. We have people saying, oh, I need my travel document. Could you get me a passport? As far as I know of recent, I think yesterday we were talking about launching a convenient card with vaccination status, but not a vaccine passport. So basically that will have your dates when you got your vaccines, where you got them from, and what kind of vaccines you received. And that will be, you will to use that card within the country, and also if you're planning on traveling outside of the country. So that's kind of where we're at with those. I would like to know what people think about the third shot, and anything else, any myths, anything else you've heard. We know our kids are going back to school, and you know, mask on, masks off. We know that kids are going to go to school with some kids who have not been vaccinated. So your child is going back into an environment, a closed environment, where they might be sitting next to a child who's not been vaccinated. How do you feel about that? What do you think should be done? And then, of course, the booster shot. Do you think we should have booster shots? I mean, what are your views? But unfortunately, we are in the midst of the fourth wave. Our numbers are rising. And the Delta variant, we're struggling with that, like they are across the border. So that's kind of where we're at the moment. So I'll stop there. And I would love to get a discussion and hear what people have to say, any contributions to the discussion. This is our final workshop, and I would love to really hear. I talked a lot, so I would like to learn from others. What have you guys heard out there? What are people worried about with getting their vaccines? I know up to now we're still giving first shots to people. We've had people who've not wanted to have their vaccines, and they still stand on the fence saying they don't trust the scientists, even at a time like this. We've had people who have had their first one, like I said, they don't want to get the second one because of the side effects that their loved one got or they've heard about. You know, when people are asking for their third vaccine, especially senior people are saying, look, winter is coming. I want to have a third shot. I don't think I'm still as immune as I was when I was vaccinated in January. We have people asking for travel documents, you know, they want to travel. So there's a lot that's going on. You know, our schools, I heard something the other day in the States where they had a PTFA, they had parents talking to teachers and there was actually a fight. The police had to come in because parents were saying at some point, oh, we don't want our children to wear masks. The only thing our children should wear across their face is a smile. And I thought, okay, that makes a lot of sense. I would love that. But, you know, we're in a pandemic, you know, let's get some masks on the kids. But some parents are, and in the US is a very interesting place because you have those people saying that, then you have the ICUs are full of people with COVID. So, you know, thank goodness we're not in that stage, but our numbers have gone up a lot significantly and we have outbreaks now. So what do we do going forward? We know it's getting cooler, temperatures are changing. What's going to happen if we have, you know, we have flu happening at the same time as COVID? Will flu and COVID get together and form a different variant? You know, are we going to have, maybe will we have another variant coming up during winter? Perhaps, you know, all these things sort of in my mind, I'm kind of thinking, what's the next step? And, you know, when do we get over this? Are we winning? You know, so we'd love to hear from you. Thank you very much. I see there's a hand up here.
Oh, Dr. Jennifer, good evening. Thank you
Good
so
evening.
much for a very informative session. So I'm just wondering, sorry, it's a bit noisy where I am, as the rates of vaccinations are going up and our children are returning to school next week, is there anything to be scared of? If parents are vaccinated but children are not vaccinated because they're below 12, is there a chance that I don't know, it seems to me like a nightmarish situation, but maybe not. Yeah, would you go homeschool because your children are not vaccinated and you are vaccinated? And
Yeah.
it's just a mess, isn't it? I don't know. What are your thoughts?
Yeah, it is scary. You know, I was thinking, because we say when you get vaccinated, you're not only protecting yourself, but those, you know, your loved ones around you, including your children, right? But you're right. A lot of parents, maybe a lot of families have been vaccinated, but we're sending our children into an environment where we don't really know the next child or 2, 3 children sitting next to them. We don't know, because there's no mark on your forehead saying I've been vaccinated, right? So we don't know who our kids are going to be sitting next to if they've been vaccinated or not. So there's that sort of fear, but then there's also the fear of mental health. And I think that one's something we've not talked about, that, you know, children do need to be in that environment where they mix with others. You know, there's that social isolation, we know is not good for one mentally. We've gone through lots of lockdowns and we don't know when, you know, this thing is going to come to an end. So do we keep our kids away from the school environment and for how long? So one has to kind of look at that as well. You know, the teachers are going to try their very best. The schools are going to try to keep all the measures, you know, make sure kids have washed their hands and, you know, masks are worn in places where they have to be worn. But yeah, the fear is real. I mean, I think parents we're all going to be scared. We're all scared. We don't really know what's happening. Kids mix all the time. They touch each other's faces, hands. You know, are they washing their hands? Is someone really going to follow up and make sure they wash their hands all the time? We don't really know that, especially for the younger ones, right? So there's that fear too. What's going to happen really? You know, we're going to go through the same thing as we did before, where people sort of, schools are closed all the time. You know, now that, you know, things change, they're not going to be isolating a whole cohort of students. You have to go home, yes, if you have symptoms, but we've relaxed a little bit with our measures. So, you know, I would say we need to take our kids back and see what happens, because, you know, our scientists are doing the best they can. Public health specialists are watching the situation. If things get bad, we know we'll go into lockdown again. But for now, we also need to be kind to the children and let them go and mix with other children. You know, so my mind, I don't know. I have the same concerns. I've got kids too, and they're going back to school, and I'm also worried. I'm concerned. So I didn't answer your questions. I was so concerned and I have no answers really. I don't know what to say. I wish we could put a bubble over all our kids, but they need to go and mix with others.
Never let them go. Sorry, the second thing is I'm just wondering, do you see a lockdown coming to Alberta? And do you see the mask mandate being reinforced by the city of Edmonton with the rising numbers? Is this what you're getting? Are you feeling this when you do community work and you talk to people, clinicians and people like that in your world?
Yes, well, with the numbers rising, I was looking at the news today. I think there's something like that happening in northern Alberta, if I'm not mistaken. If the numbers continue to increase, the officials would have to close down. I think numbers are high as well. It's summertime. People have been going up and down. So it doesn't help that, kids are going back to school, definitely. But if the numbers reach a certain peak, yes, we will have to lock down again, unfortunately. I don't think we're out of the woods yet completely, but we just have to watch day by day, unfortunately. Things change all the time.
Yeah, Dr. Jennifer, could you please remind us as we approach the new school year of the kind of vitamins as parents we should be taking, especially those of us who are maybe slightly big and in our 40s? Yeah. What should we be adding extra to our diet? So
I'll tell you what sure. Sorry, I'll tell you what I take. I take vitamin D, D and C, D and C every day, right? Vitamin D is very important. You can see the weather outside, right? We won't have a lot of sunshine during winter. So I would definitely keep up on the D, the C, good for immunity. And for people who say we shared last time, I take ginger, garlic and all that, anything that builds your immunity, please take it. Because we're not out of the woods yet. We're talking about a fourth wave. The flu season is starting. So there's a lot, like I said, I hope flu and influenza and COVID don't come together and, become a terrible force to reckon with, unfortunately.
Thank you, Dr. Jennifer.
Thank you, Dr. Jennifer. I hear you there. That scares me. Flu and the COVID-19 making a wicked baby. Bride of church. It's really scary. But I think to add to your point, I'm all about the common sense approach. Yeah. And I hope that parents, just everybody especially in our community, and let's stay away from the myths. Let's stay away from unproven facts, and let's just do basic common sense things like keep a kind of sanitizer in your children's bag and remind them every second to use it. Spray them. I spray my children. I just douse them generally. Maybe not, quite like that, but generally, implement proper hygiene, and also does zinc work? I'm just curious because
yes.
Okay, good.
So for immunity, so yeah, D and zinc, vitamin D, zinc, C. Yep, you're on the right track.
Yeah. Well, once again, this information session is to our community, and we're going to put it, of course, on our website, and and let people understand that it's important that we take this pandemic seriously. Some people what I've been hearing is that, oh, it's just a money grabbing. Oh, it should be over by now. Oh, it's not necessary. Oh, and there's a lot of skepticism. And what I say is, if all the doctors, WHO, CDC, and all these big agencies have said this is important, it is important. And we should, because people are dying. Look at India, look at South America. It's been quite a bit of and it's what it is. It could be apocalyptic in nature or not, whatever it is. The key is once you're dead, you're dead. Don't die.
That's it. So just one thing I didn't talk about were the cases in the hospital. I think they did a breakdown about close to 80% of people in hospitals have not been vaccinated, right? That's what we're seeing right now. So close to 80% not vaccinated. About maybe a 10% have received their first dose, and there's just a small breakout of people who have been fully vaccinated. And those fully vaccinated above the age of 60. That's the number there, 60, 65. And that's why countries like Israel, the UK, they're going, that's the number. When they think third shot, they're thinking people 65, 70 and above.
Okay.
Yeah.
Okay, I hear you there.
Dr. Jennifer, I just wanted to ask, are you seeing a rise in cases of children under 12 those children who have not been vaccinated? Are you seeing a swamp of kids in hospitals right now?
No, not here. We haven't seen a swamp of no, not in Alberta. And the people we look after, I think we've had 1 or 2 kids who got sick or got COVID from daycares. If you go to Alberta Health Services, they have a list of places where there are breakouts, where the outbreaks of COVID, and there's some daycares listed on there, right? Unfortunately. So we have some kids who are positive, but not in hospital.
Dr. Jennifer, in the news today, Alberta is introducing, they're not saying it's the vaccine passport. They're not calling it a passport. They're calling it something.
A convenient card.
Convenient,
yes, it's called a convenient card. Yeah.
What are your thoughts on that? Do you want to enlighten us a bit about how we can get our hands on the convenient cards?
Yeah, I think they're going to work with your health professionals, your family doctor, they're the ones who can trace and see. Because if you look in Netcare, which is a provincial system, if you've had your 2 doses, that stuff is on there. So if you go to your family doctor, they can pull that information up for you. I think that's the plan though, but we're still yet to hear about the implementation of that convenient card. They didn't want to do a COVID vaccine passport, but they prefer to have a convenient card. So people are starting to ask, where's the card, where's the passport? But again, we're waiting for more information. But your family doctor will be the best person who can pull that information for you because it's listed on Netcare.
I'm just wondering, is it not just a change in terminology that the card could be the passport?
Yeah, I think it will work because that's what we're going to use here. That's what we're going to be using here. So, I'm sure like now people have flown to the States with the papers, the 2 papers you're given, right? And they have that, and that should be okay. So COVID, because the fear is that if you have these loose leaves of papers, you can easily lose them, right? And then not everybody will be able to access Netcare or wherever, depending where you are, right? So a card would be a good thing to have. Very important, especially for people who had the AstraZeneca first. That was quite key that they unfortunately it's in there. And we didn't talk about this, but if you look at those who were going into countries where AstraZeneca is not, is being frowned on, I guess the US. So you might go have the AstraZeneca, then you might have your 2 Pfizers or 2 Modernas in there. So you show them that, yep, I did get AstraZeneca, but hey, I cleared things up by getting 2 other mRNA vaccines. So any myths out there, any new things that people are hearing? Anything? Yes.
I haven't heard anything new. What I'm seeing is people are getting really tired of saying about the pandemic, all that it still exists, and they're like downplaying it, and they're not remembering the flu season, is coming upon us again, September, October, and people generally just get sick in that season. And so they're tired of that. And I don't know what kind of information or how we can get them to say, I know it's been 2 years out now and it's a pandemic. The reason why it's called the pandemic is because it does exist. It's a stretch, it's a long suffering kind of deal. And so that's why I guess this kind of vaccine sessions that the federal government has made available, we're really grateful for that opportunity that they've been able to do that. It shows that they care, it shows that they're interested in, that's, so that's pretty important that we keep getting the word out and the message to people. I wonder if there's anybody else who has any other questions.
Yeah, there's a question here in the chat about the challenges that Black communities facing generally. What are your thoughts on how our community can manage mental health issues going forward? Again, that is sad because we've had, the isolation, losing people, not being able to see other people, and all the things that have happened. You've lost your job, your livelihood, really. And that is really in seeking out, again, I'd say your family doctor who can help support you with that, being part of groups. I know there are community groups like I'll mention BCW, Black Canadian Women in Action. That's a group there, and they always have sessions there. If you're able to tune in, there are also virtual things you can do as well, being be part of. I find that, that we've been at home quite a lot, that I know some people say they find virtual stuff very helpful. They listen into a session on mental health or just something else that takes them away, like you said, Tayo, that talking about the flu, the vaccine, the pandemic all the time is also mentally, it's exhausting. It's on the news and the radios, everybody's talking about it. You kind of want to think about something completely different. And just also speaking out, if you feel you're not coping, you're not managing, you need to talk to somebody, and I guess question, who is that somebody? It could be a loved one, it could be your friends, reaching out. And also to people in the community, I say to them, reach out to your friends, because you don't know what someone's going through right now. You may not have heard from someone in a long time. We don't really know what's happening. Let's try as much as we can to be compassionate, reach out to others. Hey, check on people. How are you doing? How are you coping? How are the kids? It is a difficult time, and we don't know when this is going to come to an end, unfortunately.
Thank you, Dr. Jennifer. I'm happy you brought that up. I was also reading that chat, and I realized that social isolation is a thing. And one group that is really dear to my heart is the seniors.
Yes.
Parents, they're there. We don't know, should they go out, should they not go out? Yeah, and so at the Social Media Foundation, we have a seniors painting class that we are hosting starting September. We'll put the date on the website, and it's for seniors, ages 55, 65 and above. So just come, mingle, and paint. We have a painting teacher, an artist painting teacher, an artist who would come and teach seniors how to paint. And it's also to combat the scourge of social isolation. So I just wanted to put that out there, so that also at the Social Media Foundation we do that, along with, of course, BCW and other community local organizations. I have other comments here.
Yeah.
This week I was talking to a pastor who did not believe in COVID. Is there a way we can get religious leaders and community to build the campaign to get vaccinated? Another person that says, what advice can you give caregiving adult children who are struggling with adult parents who are putting themselves at risk and refusing to take the vaccine? These are such wonderful yet important comments. The religious leaders who will look through for help and support, that's important. And also adult children with parents. Oh wow, I'll let you take this one, Dr. Jennifer.
I think I was going to say, for the religious leaders, again, it's having them being a part of sessions like this one. Let's be wide with our invitations, perhaps. I was saying, we invite people in the community, but let's also reach out to those groups, to those leaders in the community who can be influencers as well. Because talking to us is fantastic, but we need to reach out to them. They influence a large group of people. Let's bring them into the discussion. It's unfortunate, but sometimes things begin by having a discussion. There may be myths, beliefs. Maybe we can bust the myths that they're carrying around. We don't really know why. It could be the question of the Antichrist. That could be the thing they're thinking about. There's a mark of the beast, for instance. Let's talk about that. Let's unpack that. Where does that come from? So I feel like we should engage them as well. Seek them out. Actually, physically go seek them out. Intentionally seek them out and say, look, we're having a discussion on COVID vaccines. Would you like to attend? That's the one thing I would think about. And then for children with adults, we have had that a lot. We've been into families where they're multi-generational families where we vaccinated mom and dad and the children, but the grandparents are saying no. Again, it's a conversation. You've got to see it in their context, their age group, and depending where they're coming from as well. Lots of people from Asia and Africa, the parents are saying no. And they have those historical sort of things that happened in the past with vaccines. And they will tell you in 1970, 1960 something, the vaccine was given to a child. This is what happened, have the conversation. Talk about what were the vaccines, what was the nature, what was going on around that, what are you actually scared of? But we find that sometimes when we go in or we're looking after people, we don't take time to talk to the seniors as well. We need to talk to them, and they'll come up with all sorts of wonderful things they have to give, lots of advice they have, but let's hear them out, because we don't talk to them. We have their children calling. There's one who calls here, I think every week, saying, can you guys get my mom to have the vaccine? Well, what is mom scared about? What are her fears? What happened in 1950 that she's scared about? Let's talk about that. Let's discuss the pandemic. Does she really understand what the pandemic is about and what's happening and how these vaccines can help with prevention? So we need to do a lot of talking, unfortunately, and having the discussion before we can get anywhere. Those are my thoughts.
Those are great thoughts, Dr. Jennifer. I agree with you. I think that we really need to talk more. I'm more concerned about the religious leaders because they do control a lot of the, I guess, mindsets of people. A lot of ethnic people go to either a mosque or a church.
Yeah.
Consistently, and if your religious life is not on point. And I also think that we should do more. Everybody listening should make an active point to involve their religious leader and see where they're at, because it's important. I know that the Bible says specifically follow the law of the land. So I don't see why a Christian pastor would say no to understanding this. So it's important. I have met some religious leaders who have taken the vaccine after contacting the COVID-19 itself, and they realize that this is true. So it's what it is really. But I think you're right about we're going to need to just keep at it and keep doing it and keep at it and keep doing it.
Yeah.
And that's super important.
Yeah, it's chipping away slowly. It can't sort of happen overnight. I was listening to a pastor in Zimbabwe just last week, and they were saying that, look, I'm not a health provider, I'm not a clinician, I'm not, a scientist. I have a different kind of calling and expertise. So go to your local, clinicians, get advice from there. Come to me for pastoral advice, but not for advice on scientific matters. And I thought it was really good that he said, I did the same thing. I also went to my doctor and asked, should I take the vaccine or not? So it's nice to hear him talking in the church and telling a whole bunch of people that, go and ask these questions. You have questions to ask, they're valid questions, go and ask. So I think, yes, we do need to talk to our leaders, bring them into this discussion. They should be part of this discussion. Any other questions, comments? I don't know. I see T. I don't know if T, your hands up or
me. No.
Okay, you're good.
Yeah, I think that this has really been a very wholesome conversation today about this. I think the awesome yet that we've had around this things. I am scared about my children going back to school in September or next week when they start. But what do we do? I think once again, I am going to emphasize and reemphasize the common sense approach. Talk to your children, ask them, how do they feel? Give them all the vitamins, pray hard, douse them with enough alcohol to, I don't know what I would do.
Give the bugs away.
Give the bugs away. Soak them in a tub of alcohol. Okay, don't soak them. I'm not a doctor. Don't soak anybody anywhere. But yeah, I think it's really an interesting, bittersweet moment right now that we want them to go back to school and start the next grade, but then we are scared to send them. It's just what it is. We're all gonna be together as a community. We're gonna keep reaching out to people. Our foundation is obviously there. I'm sure Dr. Jennifer, your organization is also available to answer any question. The federal government, ECF, lots of BCW, lots of organizations are out there who are offering help, support, mental health things that will be of help to the community. So I guess if anybody has any other question, they can speak now, or I wonder if anybody has any question. How are we on time? Oh, I have 5 more minutes.
Yeah, 5 minutes. Yeah, I would like to hear from the community. What do they think? Is anyone keeping their child home from school? I don't know. It'd be interesting.
There's a comment. Let me see. Somebody is saying, oh, thank you. I haven't decided if I'm keeping my children home from school. Homeschooling. Last year, I realized that I have major support, major respect for teachers. Before then, I didn't know that I like teachers so much. And then COVID happened. I love teachers, love them. So no, my kids are going back. I have nothing but respect for my grade 4 teacher. You have no idea. So
I can imagine.
We're going back, but I'm going to apply a lot of common sense, I wonder the booster shot, so it's going to be just like another vaccine then, basically, same concentration, same.
Yeah, I think so. We're yet to get, confirmation of what that's going to entail, but it'll be the same vaccine, really.
Okay.
Yeah.
Okay.
There's a hand up here from Halima.
Oh, Halima, please go ahead.
Yeah. So it's along the line of the booster shot. So what would you say to anybody who, if Canada is introduced to this booster shot, when it happens, what would you say to those that are kind of hesitant about getting it because they're like, well, I got my vaccine, I got both doses. Why do I need a booster shot, right? What would you say to those that are hesitant about it?
Well, I would say like the flu vaccine, when you get antibodies, they work for a certain period of time, right? And the way the reasoning behind the booster shot is that your antibodies have decreased, your immunity has decreased, and therefore you're getting that booster to increase your immunity. So, and Delta is going up, it's still around. We're still in the pandemic. So I would say, look, you could wait it out and have your 2 vaccines, or you could get the third one because you've been offered the third one, right? And again, we're being guided by the scientists as they know how long your antibodies last. If they're saying that, for those who got vaccinated in January, for instance, you can't go to another January waiting to get your, and say you're fully vaccinated. We're seeing breakouts now from senior people who are older. Like above 65 are in the hospital right now, having had the 2 shots. We're seeing people who are over 70 who are in hospital. That kind of tells you, if you think about it, that maybe the immunity is wearing off, right? It's decreasing. So, and if we're saying, well, you know what, we don't have Delta anymore, we're now COVID-free, I don't need that, great, but we still have it, right? And the Delta has not been, it's not been eradicated, right? And then we know that flu comes around, like Tayo was saying, people get sick with flu. So now we're going to be dealing with flu, COVID, a combo, like what's happening? So if you're offered any kind of, shot to increase your immunity, I would definitely advise that you go for it. People are saying, oh, I might not get the flu vaccine, I'll still have COVID, but then that's a different thing altogether. That's one thing we didn't talk about. I would still say there's a flu vaccine program in the province. There's a reason why flu is a different virus. Do get that. COVID is COVID. This is the flu. There might be some similarities somewhere, but it's influenza season. Get your flu shot too. So unfortunately, we're being jabbed quite a lot, unfortunately, but it is what it is.
Yeah. Another question I had, I joined a little later, so I apologize if you answered this already. But on Wednesday, the BC government implemented that they're doing masks again. Yeah. Do you foresee Alberta maybe bringing that back?
You know what? If the cases increase, yes, like looking at places like California as well, the cases did go up, and then we're forced to get back to that. And remember, with the masks, we were protected from the COVID and the flu. But now if you say masks off, it means we're going to have flu, we're going to have COVID, everything is coming at us. So if we look at the numbers, COVID is going up, our flu is going up, the province might say, hey, get your masks back on again. So that's a possibility. I still keep my mask on if I'm going indoors. And I, like, Tayo was saying, common sense, really. It's getting cold November, walking around without a mask. I would say it's quite brave, where things are still at right now.
Thank you.
Well, thank you very much, Dr. Jennifer. Everybody who has contributed, I am super excited that you are here, and thank you so much. Once again, my name is Tayo L. Nathan. I am Executive Director for LCC Media Foundation, our sister company, Ladies Corner, and we publish information dissemination organizations to the point that our lives might be impacted for greatness. So this is it. This is the end of our vaccine literacy campaign. We've put on 3 campaigns. So to inform the community about the importance of the vaccines. We have Dr. Jennifer here, who is board certified and super qualified to give these vaccines, as you can see from the, to give this information sessions, as you can see from our bio. Yeah, so this is the end of it all. I just want to say thank you to everybody for coming. Our website is also cmediafoundation.ca or ladiescorner.ca. If anybody wants additional information. Thank you very much. Once again, this has been brought to you by LCC Media Foundation, the federal government, FFBC Foundation for Black Communities, and ECF, and also Dr. Jennifer from Canada Homecare Group. Did I get that right, Dr. Jennifer?
Correct, you did.
Yes. What is your website? If we want to look you up, how do we find you?
Yeah, so it's CanadaHomecareGroup.ca.
CanadaHomecareGroup.ca, CanadaHomecareGroup.ca. Thank you everyone for coming. If you have any questions, please send us an email, leave a chat on the website, ladiescorner.ca or lccmediafoundation.ca. We're here for you, for the community. We believe in passing out information that would help our lives, improving quality. It's been my pleasure to host the sessions. I'm super excited. I hope that as we all go back to school, our children go back to school, go back to work in the fall, that we are safe, that we don't lose anyone. Yeah, and that's the protection of God is upon us all greatly. My heart goes out to every one of us who's lost family, loved one members back home, even here in Canada. And I really do hope that you heal well. Anybody suffering from any kind of mental health concerns or challenges, reach out, don't be silent. Just reach out. And we're here for you, we're here for each other. We're gonna get through this. Maybe next year we're going to do sessions on how we survived the pandemic. See you on the next slide, guys. Thank you so much, everybody. If anybody has any questions or want to stay, this is it. 6 to 7 to 7:02. You're free to leave. I have comments here. I'm just going to read them briefly as people are staying. I have, thank you for the discussion. I've enjoyed being here and learning from you and everyone. How was you, Dr. Jennifer? This was dedicated as usual. Thank you so much. Another amazing session. LCC Media Foundation, Dr. Jennifer, thank you. Thank you, Dr. Jennifer. You've been very kind. You've been very patient. We're very excited to have you. Yeah.
It's a pleasure. I've basically enjoyed the sessions. I learn a lot from people. So that's why I always ask, what else is out there? And like you said, we're in this together, and hopefully next year, my goodness, this will be over and we'll be talking about it, right? Celebrating.
Yes, I would like to sit on a session that says how we
survived COVID.
How we survived COVID. I'd like to do that one.
Please do send me an invite. I'd like to come and listen. That'll be a very informative session because it's been something.
It has been.
Yeah. And it's still lingering. We don't see the end of it yet. And, we had our kids go to school last time and that didn't work out that well. So yeah, lots of nervous parents. Rightly so.
I can imagine.
Rightly so. So
Dr. Jennifer, if you be kind to transfer me back host.
Okay.
So that I can go ahead and on a high note.
Okay.
Almost.
Thank you, everybody. Thank you, Tayo Leslie, Nation 703. God bless you, Sister Tayo. Thank you so much.
Okay, then I have some supporters.
You're popular.
I'm very popular.
Thank you, Dr. Jennifer. That was awesome. But I'm conscious for time. Tayo is not conscious. We need to release people as promised.
Well,
okay.
Dr. Jennifer and I are just chatting. Where everybody's free to go now. Thank you.
Should we stop the recording?
Okay, you can stop the recording and just transfer back host to me so that I can just end it all.